You're welcome to another episode of Fertility Talk with Olarunke Thaddeus. Yes, in series of 3 weeks ago, we started a topic on fibroid and various options you can explore to take care of your fibroids. We're discussing another treatment option. Yes, it's another treatment option for fibroid, but truly it's an headache to a lot of women. It's the major concerns, okay? I am talking about no other procedure but hysterectomy, a total womb removal. I know you two says, where you are. Yeah. When a woman has to choose between keeping a womb or removing a womb, I think that is the most critical stage in any woman's life. Even those that have given birth before struggle with that decision, let alone a woman that has not given birth before. More painfully is a decision you want to make or is made to save your life, a matter of life and death. So to say, even more painfully if that decision was taken for you. There was a story of a lady that she did CS. After the CS, the blood did not just stop, and they had to take her back to the theater, removed her womb. She was not even conscious at the point when her womb was removed. So she wake up to it, and consent form was signed by her family, her daddy, her husband was all there, okay? So many scenarios as such are around, or there are just few cases that you can think about for this kind of stuff to happen to any woman, okay? And most importantly also, when it borders on life improvements, then a woman would also need to think and choose life over keeping a womb. So let's go to the topic proper. So when you've done hysterectomy, what it means that you cannot get pregnant again. That's the truth. Carrying pregnancy is impossible. I've never said you cannot become a mother. I have just said you can't carry pregnancy again. Okay, so that's one of the major flaws to this procedure. So for women who still want to give birth and has done this procedure, yes, this is a major flaw. And if you haven't entered menopause, yes, also you might not be able to menstruate if you have done hysterectomy, unless you're placed on hormone replacement therapy. Why do someone need hysterectomy? I have spoke about circumstances beyond one's control. There are also circumstances, yes, in fact, majorly circumstances beyond one's control, because I don't think any woman would want a womb to be removed for whatever reason. But when there are circumstances beyond your control, then there is nothing you can do about it. You would need to choose life at that point in time, okay? So one of the reasons why hysterectomy is done is when a woman has severe, heavy bleeding. They have affected with heavy bleeding. Some will bleed from beginning till the end of the month. They will lose blood. This is a circumstances that is beyond any woman. Some women are affected with this. The blood will not just stop. It's usually a mess. They can't even enjoy their life, okay? So at the point when this decision is taken, yes, to improve their life quality, hysterectomy became a matter of importance, okay? So one of the reasons for hysterectomy is heavy bleeding. Also, one of the reasons for hysterectomy is fibroid, which is even why we are talking about this topic, because in the last couple of 3 weeks, we've been talking about fibroids and various options you can use to treat your fibroid, okay? If you have a very big fibroid that has made mess of your womb and caused you to be bleeding non-stop, of course, at that point in time, your doctor might suggest hysterectomy for you. And probably also you have a fibroid that keeps reoccurring all the time. You've done the first surgery, second surgery, third surgery, even fourth surgery. At that point, what matters most is the quality of your life. So the doctor might want to look at you doing hysterectomy once and for all. especially if you have given birth and your womb is no longer needed for anything again. Okay, yes, another reason why a woman might decide to go for hysterectomy, to have a total womb removal, is if there is cancer of the womb, of the uterus. Yes, that has to go also, because you will always choose life over your womb. So once you're alive, there is hope, right? Yes. So that's just some of the reasons why hysterectomy is done. Okay. So talking about fibroids, which is one of the major reasons why we are treating this topic today. Yes, the presence of fibroid itself could lead to a situation where a woman would have to do hysterectomy procedure. Of course, fibroids are non-cancerous growths, and they come in various sizes, and they come with some crazy symptoms in most of the time. Heavy bleeding, they can cause heavy bleeding, they can cause pelvic pain, excruciating pelvic pain, discomfort during sex. They can mess up the quality of someone's life, a woman's life. Okay, so the presence of fibroids, yes, is associated with all these things I have mentioned. And when it is affecting you, affecting everything about you, you can't even do anything with your life again. All you think about is how to live and adjust with your condition. Then of course, to improve the quality of your life, hysterectomy might be considered. Okay, so let me just talk about things you should consider before you do hysterectomy. Okay, so if you're opportuned to be at that table when the decision is made, okay, on whether to keep your womb or to let your womb go, so please discuss options such as if your cervix or your ovaries will be protected during the surgery, especially if you've not given birth, okay, and you still want to give birth. So you have to discuss that option with your doctor. It is very, very important, okay? So that is my one thing you should keep in mind, okay, before you do hysterectomy. And if you are watching this video and you want to take that decision for someone, you are opportune to be at that table, and you know that that someone has not given birth before, please also discuss that option with your doctor. To option to preserve our cervix and to preserve our ovaries, okay, except if it is beyond your doctor's reach at that point in time. Okay, there are various types of hysterectomy. We have total hysterectomy. Total hysterectomy, the womb, the cervix are removed, okay, and this procedure is performed during operation. It's a major surgery, okay. We have subtotal hysterectomy. In subtotal hysterectomy, main body of the womb is removed, the cervix is in place, okay. Total hysterectomy, we have total hysterectomy with bilateral sapigourectomy. The womb, the cervix, the fallopian tube, the ovaries are removed during this procedure. Then, of course, we have the radical hysterectomy, where the womb and the surrounding tissues are removed, including the fallopian tubes and part of the vagina, the ovaries, the lime glands, and the fatty issues. All of them are removed during this procedure. Okay, so to the next subtopic, which is fertility and life after hysterectomy. Yes, fertility and life after hysterectomy. Just like I've said earlier on, that your ovaries, you should talk about the need for your ovaries to be preserved. If your ovaries are removed, however, during hysterectomy, that means that you will go through menopause immediately after the operation, regardless of your age. Yes, this is known as surgical menopause, okay? If one or both of your ovaries are left intact, there is a chance that you would experience menopause within 5 years, okay? So you could actually plan, okay? Make a plan now, because yes, it will throw you into menopause if one or both of your ovaries are removed. Okay, then if you experience surgical menopause after having hysterectomy, you will be offered HRT, hormone replacement therapy. Okay, you might also consider using donor egg options if you want to have your baby, and of course that means that you will need to do surrogacy, meaning you will have to use a gestational carrier to birth your baby, okay? So this is majorly the fertility life after hysterectomy is done. You will need a surrogate mother to help you to carry your pregnancy. Or better still, you might want to consider adoption. Okay? Yeah. So thanks for watching today's episode of Fertility Talk with Olarunke Thaddeus. For more information or inquiries, please comment below. And if you want to book appointments with us for consultation, please call the number showing on your screen. Don't forget to follow us on Instagram at @MeetSurrogateMother, and please kindly click the subscribe button after this. Thank you.